Hi, everyone. Thanks for joining us. My name is Olivia Hill, and I just wanted to do a brief land acknowledgement. So Nature and Health acknowledges the Coast Salish peoples of this land which touches the shared waters of all tribes and bands within the Squamish, Tulalip, and Muckleshoot nations. We have a responsibility to acknowledge our Indigenous connections, as well as the histories of dispossession and forced removal that have allowed for the growth and survival of this institution. Next, I just wanted to share the mission of UW Nature and Health. Nature and Health seeks to understand the connections between nature and human health and well-being. We work to translate that understanding into programs, practices, policies, and the design of healthcare, educational, and community settings that benefit all people and nature. So today we're really lucky to have another Olivia joining us. Olivia will be presenting today. Her presentation is titled Exploring Personalized Virtual Nature as a Tool for People Living with Chronic Obstructive Pulmonary Disease. Olivia, her, is a fourth-year PhD candidate in the Parks, Recreation, and Tourism Management Program and the lab manager of Clemson's Virtual Reality and Nature Lab. Her research interests include studying the psychological and physiological impacts of nature and virtual reality, as well as using virtual reality as a form of storytelling. Olivia has 15 peer-reviewed publications and one co-authored textbook chapter that explore concepts such as green space, virtual reality, gender, COVID-19, and leisure. Olivia is originally from Maine and enjoys getting outside to enjoy nature, especially Acadia National Park.
Awesome. Thank you for that kind introduction. I am super excited to be chatting with all of you because this is something that is near and dear to my heart. This is my dissertation. And this is also the first time I'm going to be speaking in like a public space about the research that I've done with my awesome team. And I'm just excited to talk about virtual nature, nature personalization, and a population that is near and dear to me with severe COPD. So this is sort of our plan for today. We're going to talk about research philosophy, goals, and then the methods themselves, which is one of the parts I'm most excited about because this protocol was established specifically to answer these research questions, the findings, the implications, and the future directions. So I think without knowing where I'm coming from, it's hard to know what is this research? How is Olivia approaching this research? My big research philosophy is storyteller, story listener. So everyone has this story, no matter how big, how small, it might seem important to them and significant to society or the other way around. But as a researcher, I see my role as being that story listener. So often, and in past studies, I've said, oh, this is a problem with nature literature research. I want to accomplish this. And this study was taking a step back and listening and saying, where can I make a difference that's meaningful? I think it would be remiss to not acknowledge that this study, because it's working with a clinical population, is so interdisciplinary. Interdisciplinary research is something I'm super excited about. My degree is Parks, Recreation, and Tourism Management, coming May 2023. But the other fields I'm working with are nursing and health communications. So just as a sort of sneak peek, we're going to be talking about that first bullet today about psychological well-being benefits, and then the preliminary evidence. But I have also worked with this data set to explore the counter narratives and narrative resilience of living with severe COPD, which we'll define in a second, and also defining moments of being a researcher during end of life. So what is virtual reality? A lot of you may be familiar with virtual reality. It's becoming something that is more commonly talked about. A lot of people I know have said, oh, I've seen those on commercials, or my nephew or my grandchild asked for a virtual reality headset for Christmas. So VR, how we're defining it for this study and in general, is an environment that's computer simulated. So it is not real, but it feels real because it's immersive. You can explore in this environment, and it's also three-dimensional. So when you put those goggles on, because the VR that was done through an Oculus, which is a common headset, you are able to see the image 360 degrees and it moves with you. The sound also moves with you as well. You can look up, you can look down, the image is completely surrounding you, and you're able to explore that world. So COPD. COPD is chronic obstructive pulmonary disease. It is one of the leading cause, it is not the, but it is one of the leading causes of death in the US, and it affects more than 15 million adults in the US. It's also near and dear to me because it's very socially stigmatized. A lot of people assume if you have COPD, that means that you are a smoker. You may have made some life decisions that caused you to have COPD, when in reality, COPD comes also from secondhand smoke. It comes from genetics. It comes from environmental pollutants. It comes from working conditions. So often COPD in the literature is stigmatized, but there are so many reasons someone can have COPD. And the biggest thing about COPD is it damages the lungs and makes breathing difficult. And when breathing is difficult, everything else is difficult. Physical functioning will decline over time. If air is not able to be utilized in the lungs, it makes just doing everyday tasks you more exhausted. It makes being able to be physically fit really hard. And it overall impacts quality of life. For this study, we're going to be looking at severe COPD. So when people are first diagnosed with COPD, they may be able to do their everyday activities. But as you progress to severe COPD, because COPD currently has no cure, your lungs will just start to deteriorate. So severe COPD and outdoor spaces have an interesting relationship. So for someone to be outside, working with my participants, for example, a lot of the places that they wanted to go in virtual reality were maybe 20 or 30 minutes away from their homes. Because even just planning a day outside or a trip takes so much planning, forethought, precautionary steps. Alerting a medical team, making sure there's oxygen tanks, making sure that if something were to happen that you're near a medical facility. Those are just a few of those things. So you can imagine taking trips, visiting places is really hard to do. And that doesn't even come to terms with if you're want to go visit your favorite mountain, for example, and you want to hike up that mountain. That also takes physical fitness, and you have to have be able to utilize your breath to be able to do those outdoor pursuits. So having severe COPD in outdoor space completely limits you. There's obviously people that are more or less severity, but the participants we're talking about today, for example, one of them, when I asked the last time that they remember being outside doing something for fun, it had been about 6 years. So we're talking about people who aren't able to connect with nature in ways that they want to or have been able to in the past. I know I'm probably speaking to the choir if you signed up for the Nature and Health Talk, but just so that we're all on the same page, nature is super good for you. It's beneficial for multidimensional health outcomes, which is why we want to help people with severe COPD get some of these nature outcomes, which we'll try to do through virtual reality, virtual nature. One of the other bodies of literature that I spent a lot of time exploring in concept with this project is topophilia. This idea that you have your doppelganger of place, when an outdoor space transcends becoming a physical space and becomes this personal place. I have a personal place. It's actually in Acadia National Park. That you feel like you have an innate connection to. And those are the places that I was interested in hearing about with the people with severe COPD. Because we all have these places that are important to us. But what happens when you have a place that's so important to you, but you're not able to visit it? And it's not because it's too far away. It's actually 20 or 30 minutes away. It's because you just physically aren't able to get there. And then the other thing that becomes a huge part of this study, and I'm super excited about, is co-creation. So this is a research method. You could also see it as a lens of research. but you're asking your participant to become an active contributor. You're asking them to become a leader. You're saying, you can have a say, like, and we appreciate it and we will incorporate that into what you want. And we'll get a little bit into how those methods looked in a second. But the main research question that we're going to talk about today are just what are the effects of participating in a co-created nature-based VR experience for people living with severe COPD? And some of the goals of my research was I wanted to promote psychological well-being. I wanted to demonstrate that this was safe, especially in lieu of a clinical population, severe COPD. And I wanted to find a way to develop a process for co-creation with virtual reality. So here's the exploratory data collection. It will make a little bit of sense, more sense in the timeline in the next slide. But we collected a lot of data. We collected interview data, survey data, and physiological data to measure the outcomes. There was a huge amount of time that was utilized with each participant. So the study was completed with it was almost a case study design where there were 4 participants. And the power of having 4 participants is I was able to build rapport. I have about maybe 10 hours each just of qualitative interviews to sift through, but we're also able to get that physiological and survey data. So we were interested in co-creation process, which we looked at through qualitative interviews. And what did the overall VR experience look like? We looked at psychological well-being with the psychological well-being scale. That scale looks at things like autonomy, environmental mastery, purpose in life, positive relationships with others. We looked at heart rate variability. And the psychological well-being scale was done at the beginning of meeting these participants and after doing the co-creation. Because we're hoping that the process of co-creation in this virtual nature would help increase psychological well-being. We wanted to know that this was safe. So we looked at respiratory rate and oxygen levels. Those are very specific to COPD. Because breathing is difficult, we want to make sure that they're able to safely breathe. And some of them were on oxygen and some of them were not. So respiratory rate looks at how many breaths they're taking in a minute. Oxygen levels look at how saturated their blood is. And then cyber sickness. We use a simulator sickness questionnaire. A lot of people, if they have never done VR, are worried they're going to get cyber sick. Most people, if you are severely motion sick, like if you get motion sick just driving in a car, you may have cyber sickness. But unfortunately, there's no way to predict cyber sickness in general. There's not like a survey or questionnaire you can do before VR. But the cyber sickness questionnaire looks at any sort of symptoms to a varying degree that you may have during the VR experience, such as nausea or having a headache. And virtual nature, we looked at the idea of what they created for the VR and how that affected restoration with the restoration outcome scale. And we looked at presence. So we looked at how restorative this environment is. And then we also looked at, like, does this person feel present in the virtual nature? And presence has a huge thing to do with, like, is this experience actually immersive? Like, did we do a good job replicating the real world? And that was done through the iGroup presence questionnaire. So this is why we were only able to do 4 participants, because I was collecting all the data this summer and it involved many steps. So we had recruitment done through a gatekeeper. Value of doing interdisciplinary research. We had a clinical population and a gatekeeper to help us through the hospital IRB process and match my research project with potential patients of theirs that would be interested in the study. I'm also doing home visits throughout the study, which is really interesting and was a new research experience for me. But as these people are unable easily to leave their homes, home visits were what people felt most comfortable with. So we did visit 1, we did that semi-structure interview. This was like one of my favorite visits because after talking to them on the phone a couple of times, this is when I went to homes and said, if you could go anywhere in the upstate of South Carolina, because I'm in Clemson, South Carolina. Where would you go? Why would you go there? And I got stories of favorite hikes. I got stories of places before somebody met a husband where they're like, oh, I used to hang out at this river and I'd meet the cute boys there. So I got a variety of stories and got to see people come alive with those outdoor memories. And also see how important it is to personalize something to somebody's favorite thing. Field work was a beast unto itself. So once people told me, oh, I want to go to, for example, Bull's Sluice, which is on the Chattooga River and is a white water rapid. I had to find the exact spot they were trying to talk about, figure out if it still looked the same as their memories, and then figure out the best way to capture that using a 360 camera. So a camera with 6 lenses, so we could make it a 360 image. So I shot all the images that we'll see in the next slide myself. But the co-creation part is I'm calling these participants, confirming that I am at the right dead end road, that I am by the right creek bed. And then we're going, visit 2 was getting to show these videos. And it was this incredibly special and meaningful moment where a lot of these people hadn't seen what these faces look like. I often get the question, were people disappointed what faces look like? And for the large part, no. But humans have a huge factor in how things change. There were a couple of places that I wasn't able to go to because they didn't necessarily exist in the same way anymore. But participants got to choose what video clips they wanted, the order and the sequence of the video clips, the length they wanted the overall VR experience to be, and the soundscape, so the sounds that you're hearing. Usually, the fun thing about doing footage for VR is the sounds are usually terrible because you're picking up cars and airplanes and other people and noises such as that. So the participants were able to say, oh, when I remember this place, there's like a really loud bird or like the babbling brook noise. So we were able to build what the soundscape sounded like to meet their memories of that place. So after editing that, I came back for visit 3 and we were able to share the VR experience with the participants and caregivers, and a lot of times other family members. And then we collected a lot of that physiological survey data, conducted informal interviews, and then did a last reflection interview on what it was like to visit that place again. So this is the slide after this that is I'm most excited about, but for context, we are going to be using pseudonyms throughout all of this. You can see that their ages vary greatly. During the course of the study, David went from being at home to being in a hospice facility. So I actually, on the request of the caregiver and David, administered his last VR experience at the hospice facility a week and a half before he passed, which was a powerful moment of its own, to know that you were administering the last nature experience for somebody, which is what one of the papers in my dissertation talks about specifically. And then you can also, they are all in stage 4, which is very severe. Most of them are on oxygen. Most of them are not able to leave their homes. But this slide is the one that I'm almost most proud of because this is all participant designed. The name of the person that's their nature experience. You'll notice that they are different lengths, different views, different ecosystems. They were all shot in the summer, so that's why they're all generally green. But it's also interesting because you look at mountain views, you look at Henry's, and you see inside a structure. Like he specifically wanted me to go find this outdoor chapel. Or you look at John's at the end in his second video, is he just wanted straight up into the sky because he loves being able to see where the trees come together. So these are very meaningful for me to be a part of as a researcher, but also completely customized to what they imagine the experience being of being able to go back to these places. So I wanted to share in their voices some of the reactions from the qualitative data, just of being able to see their virtual nature. For David's caregiver, this was particularly important. I will always remember it because it was one of their last memories they had as a husband and wife before David passed, because it was one of the first things that had happy conversations about it, some smiling from David, because the process of hospice and end of life is really hard. We also had surprise that it was realistic. And we had people that were really taking ownership of the VR experience they created. Like, oh, like I feel like I'm getting in the car right now and I'm going to go to that place. I don't remember the last time I walked here and I feel like I'm walking here. Oh, I wanted the picnic table to be last in the sequence. I'm so glad it is. The quote that feels the most powerful to me is from Betty, and it's at the very bottom. It's just, she talked so happily about this little brook that most people would have driven by and not thought a second. It's outside of a state park, but she had no interest in me actually going to the state park. She wanted me to find this exact piece of water, something that had topophilia, had meaningful memories for her, because she can picture her kids smiling there. She can see them in the water. And that is so powerful and so cool to be a part of. So as you may have, as you may have guessed, we were able to, yes, perfect. We were able to help their psychological well-being and safety. We could attribute some of this to the VR sequence itself, but we can also attribute this to the process of co-creation and helping increase their autonomy, their self-acceptance, and their purpose in life, like those specific dimensions. I was excited that heart rate and heart rate variability did not change drastically. One of the limitations of this study is that there are 4 participants, so there is limited data analysis that can be conducted. But we can see that there's a trend that this is safe for people with severe COPD. Their oxygen levels did not fluctuate. Their respiratory rate did not fluctuate. They also all reported 0 on cyber sickness, which made me incredibly happy in seeing it as a place where VR can be a part of clinical populations. We also, for the virtual nature results, when we're looking at restoration is a scale from 1 to 7. We can see that these people felt restoration after their VR experience. And then presence ranges from 14 to 70. And we can see that most people felt like it was real, it was present. I actually had some participants, once they started the VR scene, they would put the goggles on and they would reach out for things because it felt real. It felt like another world and a memory that they were being able to relive in. So a summary for results. We found that the co-creation of virtual nature improves psychological well-being. It's safe for participants with severe COPD. And there is a way to do it in a purposeful way. The idea of the multiple visits, field work, was something that took a long time to develop. But that time that was spent in development showed that there is a systematic way to do personalized virtual nature that also includes the participant's voice. And it includes connecting with them from a person-to-person level to figure out what is the ideal nature scenario for them. I've already talked about some of these strengths and limitations. There are others. Every study has strengths and limitations, but the real strength was that it was a novel protocol that used VR and was participant forward. To date, there's been one other protocol for virtual reality and personalizing. And how they defined personalizing was bringing somebody into a room, giving them three images and letting them choose which image they want. This study goes beyond that and says personalization needs to be person first. So I'm excited that we were able to develop a start of a protocol to get to that person participant forward co-creation method. And we also utilized mixed methods in data collection. And I was very excited that we were able to get data that was not just survey, but interview and physiological data. Going forward with an interdisciplinary team in this research, those mixed methods are what's going to be able to fund this research. And those physiological measures specifically are going to be able to show, like, is this safe with a specific different populations, especially clinical populations? I've talked about the limitation being the small sample size. I think in average, each participant, if you think of the time that I spent talking with them on the phone, talking with them in person, finding the nature spots, videoing the nature spots, and personalizing, it was around, I think, 60 to 70 hours per person. So time spent personalizing, I don't see it as a limitation because it got us to this novel protocol, but it means the reproducing this research is a question mark. We're actually looking towards how to streamline this process to give people participant forward options, person-centered research, without having to have a huge amount of time spent on collecting and disseminating nature experiences. So there's like a little give and take for the time spent personalizing. The big three research implications, or my discussion, is we found that by itself, co-creation, personalization, virtual nature are all cool. Together, it seems like it's a powerful force when you combine it. We were able to show people nature experiences, but people also pick nature experience that if you looked at theory, if I looked at my biases as a researcher, I would never choose. For example, one person wanted me to find a specific dead end road in the middle of nowhere because this dead end road symbolized something important for them. It was a road that they constantly visited when they were up in the mountains when they were a kid. If you drove by this road, which I actually drove by it twice because you almost couldn't see it because it was hidden, it just looks like any other country road. But the powerful personalization, co-creation made this experience something really meaningful for someone else, which kind of lends itself to preserving spaces. This study shows the power of preserving and sharing love spaces and places. The power that I could think something was super important and super meaningful and aesthetic, and like Olivia Hill would choose something completely different. And it's that power of preserving those spaces and places, not for the next generation to share with their families. And for a lot of these participants, they saw them as leaving their legacy for their families. And that's cool to be able to have a video collection. Each participant had the opportunity to have a copy of the viewer experience that we were able to put in like a 360 YouTube video to be able to show other friends and family and say, like, some of these are really meaningful to me. This is where I grew up. This is where I learned to swim, things like that. And this study also showed how we can ease the healthcare system is so exhausted right now, COVID, burnout, all of these things. So I see this study as a potential way to support the healthcare system by increasing quality of life for chronic illnesses and diseases, giving something to participants or to people that are often stigmatized or overlooked by society, and also bringing in those caregivers into that conversation as well. So future research directions. A lot of people talk about the value of green prescriptions. I love the idea of being able to go to a doctor's and prescribe somebody time in green space. But this research really makes me start to think, how can we build onto green prescriptions? With also this idea of creating time in green space that's personalized and meaningful. And that could be virtual nature prescriptions for people who aren't able to access the outdoors. Or this could mean having somebody critically think, what are the places near my home that make me really happy, that are in green space and blue space? Other directions is person-centered nature. So I think this is just the big question for me going forward, and I pull it out to you all as well, is what happens when a participant is the driver of nature research. What do we do differently? What do we think of beyond what do we think of as outcomes? What do we think of as methods? What do we think beyond the existing theories? And then the last thing that this study has really catapulted in my mind is thinking about the caregivers. Being a caregiver is a full-time 24/7 job if you are a family member and a caregiver. And when you have somebody with severe COPD, a lot of times you are doing a lot of the tasks, such as driving, making sure everybody gets to their appointments, administering medication. You're doing a lot of roles all tied up into one, and you often don't get a break. So caregiving is something that has an intensity that is unmatched. And being a caregiver, a lot of these people shared with me is, I don't know what my life will be like after I'm done being a caregiver and with end of life care. So one of the future research directions is, how can personalized virtual nature be used for bereavement, end of life care? Those sorts of questions. So with that being said, I am so excited to have open dialogue about virtual nature, personalizing nature, co-creation. This is my LinkedIn, also my email, which I can also put in the chat. And you'll notice all the beautiful nature images were directly taken from the VR experiences. I should have said that at the beginning. So thank you all for tuning in, and I am excited to answer any of your questions.
Thank you so much, Olivia. What a wonderful presentation and such a fascinating topic. Before I open it up to everyone else for questions, I wanted to ask you a couple of questions. So what I really loved about this study was the co-creation approach, which just seems so important given the unique ways that we all experience nature, but also the loss of independence that comes along with end stage COPD. And you kind of started to touch on this a little bit in your when you were talking about the implications of your research, but I'm wondering, what was your biggest takeaway as far as how individual experience with nature and preferred outdoor spaces, vary from person to person, and also anything that was maybe surprising to you that came out of the co-creation approach?
I think the meaningful takeaway is that often when we're doing research, there's this big term that we throw over working with people with severe illnesses or diseases, and we call them a clinical population. And then we kind of have this assumption that they should all be alike. And that's completely generalized, but we generalize a lot. We might generalize that the severity of their disease, the symptoms they feel, their support with the healthcare system, and then those things that they want, like nature experiences, are all kind of generalizable. This study showed on a small scale with the 4 participants that is drastically not true. It helped me rework my biases and assumptions as a researcher working in nature research and health research, to walk away saying, we need to have person-centered research. We need to hear the voices of this clinical population instead of assuming that the doctors, the nurses, the whole healthcare system is speaking for them. So I guess I would say the thing that was most surprising from the findings were, just from a nature perspective, was the things that they chose. And it was I guess the example of the dead end road is kind of a drastic example. But we also have this assumption with virtual nature, and a lot of the research is you want something really restorative. And then I had the assumption that if people wanted to have a nature experience they hadn't had in a long time, that they'd want something peaceful, something aesthetically beautiful. And one of my favorite video montages that one of the participants viewed, it was actually David, who progressed to hospice care, was that he wanted that experience of rafting down a whitewater rapid one more time. Something that theory would say, okay, maybe he's adrenaline junkie, but that's not necessarily beautiful. It's not aesthetically pleasing. is that really what he wants in this? Like, shouldn't he be looking for solace in nature? So being able to look past maybe what was the expected and have conversations with what people actually wanted was really cool, and it made for some memorable virtual reality experiences for them.
Wonderful. Thanks so much. And one other question for you. I'm wondering, because, with your study, you're thinking about improving quality of life and outcomes for psychological well-being. And I'm wondering if you think that personalized VR could improve outcomes for COPD as far as the severity of flare-ups or the frequency of flare-ups, kind of those outcomes, and maybe not necessarily for folks with end-stage COPD, but earlier on.
Yeah, that's a really good question. I mean, anecdotally, people shared like, oh, when I'm viewing these nature scenes, it feels like I can breathe easier. So that's something I'm interested in pursuing. A lot of people use virtual nature already as a meditative tool. We have apps on our phone now that will help you breathe, and maybe the bubble gets bigger and then smaller as you inhale, exhale. I'm looking into something like that would be really cool. But we're also pursuing this work as the research team and looking into, if we're at the stage where we're at end of life and hospice care, we're looking at, does these nature experiences also decrease fear of death? Because that's something that people feel on very different levels. And there's often not an intervention that a chaplain or a spiritual leader in some sort at a hospice house can use. It's usually turns into something that's more like a talk therapy. So I am excited to see where these the virtual personalized nature can go in terms of outcomes.
Wonderful. Thank you so much. Well, I want to open it up to other folks' questions. So if you put your questions in the chat, I can read them aloud so that Olivia can hear them. So it looks like we have a question from Pooja. Pooja says, I loved the personalized co-creation and appreciate the challenges and feasibility of sustaining given the resources and time involved. I wonder if there's a model where caregivers or family members could be engaged to help with that co-creation. Otherwise, it seems difficult to imagine how this could otherwise be supported outside of research, even though it is so incredible.
Yeah, that is something that we are pursuing now. One of the biggest barriers we have had to having caregivers and families involved is the ruralness of the project and where it's placed. Internet connectivity is a somewhat of an issue in terms of getting our information to families and families getting their information back to us. But we are looking into, not even looking into, what we're doing currently right now, because we're keeping this project going at hospice centers locally, is asking when they're admitted if the patient themselves would be interested, and if so, would there be a caregiver or family member that kind of wants to take a little bit of a lead or a burden off of the person, in terms of maybe they think of 2 or 3 places, and then we're able to find videos for those places. We have VR apps now that almost work like Google Maps, so they may not get a complete personalized experience, but they can almost look as a bird's eye view at maybe their favorite horse farm or a hike that was really important to them. But you're right, having the family caregiver involved makes sort of a gateway between you as a researcher and the patient, where the patient often feels more rapport towards you and more interest in doing the research and having this experience that we think could be really beneficial if that caregiver and that family member does the pre-work. And usually the family members are super excited about doing this pre-work because they're able to think back to the memories of like what they did together as a family.
Thanks for that great question. It looks like we have another question from Josh at Nature and Health. So Josh says, it seems like the personalized co-created aspect of your project is really important. Do you have an idea of how important that is relative to just any old VR nature experience?
We do not have a direct comparison study right now, but as a part, the lab managers of Clemson's virtual reality and nature lab, We have done a lot of virtual nature experiences for things like anxiety, mood, depressive symptoms. And we have been the one that chose the nature experiences, usually based on the geographical location of what the participants are. We want it to be something, we either do it on purpose, so it's something familiar to them, or something that's unfamiliar as an environment for them to explore. And we often do interviews and follow-up interviews. And most often people are saying, this is not what I would have chosen. Or like, this is okay, but I wish I could have gone X. So there is no direct comparison study that I can point you towards. But we have had some research come out in the last year or so that talks about how when people their virtual environment was not chosen for them, it created a VR scenario that was potentially just not interesting to them, boring, and in some ways just made them not interested in doing the nature experience in VR, which is a powerful thing of then saying, okay, well, then personalizing VR and person first virtual nature is definitely a direction we should all consider in our research.
Thanks, Josh. Looks like we have another question from Heidi. Heidi says, I'd love to see how this could impact the caretakers themselves, i.e., have you thought about asking the caretakers to participate themselves, not helping the individuals with COPD to procreate, but allowing them to have these VR experiences themselves, as I would imagine they are oftentimes very constrained in what they can do themselves if they are constantly on call to help.
Yes, that is such a good point, and it's such a valuable thing that we're actually looking into because of one of the participants declining in health and going to the hospice house. We got to see how firsthand got to see how a caregiver goes from having complete identity being I am taking care of this person to a reduction of that as a staff comes in now, and now I just get to be a wife in some capacity or a family member. And you're right, they get identity is completely tied in it, and that's a lot of like emotional stress on physical stress on every level, financial stress. So one of the things that we are working now, and we thankfully just got funding for last week, is not that exact scenario, but we're coining it a VR tandem. And it is when a participant and caregiver will work together to decide on a nature experience that maybe they had as a meaningful place. For example, maybe an engagement or an anniversary trip of some sort, or a place they went often to go hiking together, things like that, tied to nature in some aspect. And then having them experience that together. And then using that with the caregiver potentially after the participant passes, to see how that helps in the grieving and bereavement process. Because I applaud caregivers because they are very strong people.
Thanks for that great question, Heidi. Looks like Pooja has another question. Is it worth exploring how much of the impact is due to the topophilia slash personalization versus the nature impact? Is it possible that visiting a favorite restaurant or relative's home could have the same impact for someone who may be limited in where they can go?
That is a great question. And it's something I'm really excited about because the answer is, I don't know. I hope so, but I don't know. It was really interesting doing this study. I'm in pretty rural South Carolina. Green space is around us. And participants, before we said like choose your favorite nature places, we start with like just choose your favorite places. And they would often say nature places. So I don't know how often they would choose something versus another. But we are looking into that idea of like, how does the effect on like socialness or the idea of being in a social situation after feeling so isolated and being due to COVID, and then being isolated due to your health status. So we are looking into seeing for one participant to just trial this out and see how it goes. Being able to attend a mass, a Catholic mass, to be like you're a part of that religious ceremony. And also, if you're familiar with Clemson, South Carolina, you probably know, yeah, they either have no feelings, a lot of feelings, or mixed feelings about Clemson football. So looking into the idea of getting a virtual nature experience of being at a football game. So a lot of the future of our lab is looking to say, we found that this system kind of works. It seems to have benefits. But how do we tie this? Is it just the social aspect? Is it just the novelty of VR, or is it the nature itself? And we're hoping it's the nature itself. But if we're able to kind of have these side projects that also have societal impacts and benefits, we're going to pursue those too. So that's a really good question.
Looks like Pooja has a follow-up. Just says, I was thinking it would be cool to test/show that the nature itself has benefits above and beyond the topophilia.
Yes, that is my hope. I am working right now on ideas of how to, I don't want to use the word isolate and make it sound really clinical, but isolate that for a nature experience. So Pooja, please reach out if you have ideas, because it feels like you have a lot of exciting thoughts about this.
Thanks everyone for your questions. Does anyone, oh, it looks like we have another question from Sonia. Sonia says, thank you for this important research and your presentation today. My question is also around the important aspect of personalization and facilitation and the labor and creativity required. My own research in physical part connection in palliative/grief care found the same required facilitation was needed to meet unique needs. In it, the importance of park and health sector volunteers and community involvement and experiences stood out. Would you consider more recommendations comparing actual and virtual for chronic and palliative care, also around the work of collaboration for this important experiences, or future study on the cost benefits, especially given the symptom management benefits and support for caregivers, as well as people with disease, disability, etc. So many lines of inquiry for you and others.
There are so many exciting thoughts there. I think that my overall takeaway reading into that, Sonia, is that I'm thankful that you're also working with palliative and grief care. Because I felt like when I went into this world as being somebody who was very thankful to be on an interdisciplinary team and not, and learn a lot through this process and continuing to learn as I work in palliative care, hospice care, is having those people that are going to give you unofficial tips, training of how to work in this space is so valuable. So I'm thankful that you are doing this work as well. I think in the context of recommending for actual versus virtual, I err on the side of caution of telling people that they should do virtual nature experiences in lieu of actual nature experiences. Virtual nature experiences, although they can be completely immersive, are often not able to be completely switched out for an actual nature experience. If you think about things like, I don't know, like vitamin D, virtual nature has not gone that good enough to be able to get things like that, and a bunch of other things as well. A study we did a couple of years ago out of the lab talked about how mood, although in virtual nature may be improved, it's still never going to be improved as much as actual nature. So often I think virtual nature and virtual nature prescriptions are a valuable tool for people who do not feel comfortable going outdoors and are not able to. So I would be excited to continue this work. And I think that you nailed it on the head when you talked about the value of bringing in community stakeholders and collaboration into this process. It's often, we often talk about how research is a really collaborative process, but I found myself reflecting on other studies that I said, oh yeah, this was really collaborative. And it may have been collaborative because I worked with other researchers, But being fully collaborative and in a community means that we're talking to the participants themselves. We're talking to the decision makers, the policy makers in that area. We're talking to their healthcare systems, for example, with this project. We're talking to them, and then we're also listening back. So I am super excited about those future study ideas. And I hope that I encourage all of you all to think more about person-centered research with nature and collaboration.
Thanks, Sonia, and thanks to everyone for the wonderful questions. And a big thanks to Olivia for her wonderful presentation and your really thoughtful answers to all of these questions.